All right, Eden, I am so excited about today's topic. Organophosphorus poisoning, or OP poisoning, it sounds intense, but also super important, especially in farming areas, right? So, what is OP poisoning exactly?
That's right, Avery. It's very important. Organophosphorus poisoning occurs when someone's exposed to certain insecticides, like parathion or melathion. These compounds are dangerous because they irreversibly inhibit an enzyme called acetylcholinesterase.
Whoa, irreversibly inhibits an enzyme? That sounds serious. And why is that important? What happens when that enzyme is inhibited? Does it just build up chemicals and then it leads to symptoms in specific areas, right? I heard about three main ones.
Precisely. This enzyme normally breaks down acetylcholine, a crucial chemical messenger in our bodies. When it's inhibited, acetylcholine builds up, leading to overstimulation of nerves. The three main areas affected are the muscarinic, nicotinic, and the central nervous system. For muscarinic symptoms, we use the mnemonic DUMBELS: diarrhea, urination, meiosis, bronchospasm, emesis, lacrimation, and salivation. You'd also see swelling, a slow heart rate, and wheezing.
Dumbbells. That's brilliant. So catchy. But if those are the muscarinic ones, what about the other two, nicotinic and the CNS? What kind of wild things happen there? I bet it's not good if it's a central nervous system.
Indeed, nicotinic symptoms include muscle twitching or fasciculations, followed by muscle weakness and even paralysis. Blood pressure can be high and heart rate fast. For the CNS, it's more severe. Restlessness, confusion, seizures, coma, and even respiratory arrest. Diagnosis is largely clinical, but lab tests confirming low cholinesterase levels, especially red blood cell ACHE, are definitive.
Okay, so it sounds like you really need to act fast. How do you even begin to treat something like this? Is there an antidote or do you just try to get the poison out? What's the immediate first step?
Acting fast is crucial. The first step is always securing the airway and ensuring the patient can breathe. Then immediate decontamination is vital, removing contaminated clothes and washing the skin. For antidotes, atropine blocks muscarinic receptors and is given until secretions dry. Pralidoxime, or 2PM, actually reactivates the enzyme, but it must be given early, ideally within 24 to 48 hours. So yes, it's deadly but treatable, with early recognition being key.